Welcome back to another episode of Living with FASD, Candid Conversations with Patti Kasper. I am Patti, your host, and this is a show for those of us who are affected by prenatal alcohol exposure, our families and loved ones, or anyone else just wanting to learn a little bit more about fetal alcohol spectrum disorders. So today I am joined by Dr. Jerrod Brown, who is a regular guest on this program. And Jerrod, I'll bet you didn't realize that this is now season 2.
I did not. Congratulations.
Episode 2 of season 2. I still can't believe I've been doing this for over a year at this point.
How many
So
episodes did you have for season 1?
52.
Great. You did
Yeah.
all right. That's awesome.
Yeah. So I guess a lot of podcasters will, go for like a TV series season and then take a break. But there's just so many people out there with such fascinating things to share that yeah, forget the break. I'm just keep going.
I love it. I'm very impressed. That's so cool.
Anyway, so for those out, in listener land or watching on YouTube or Spotify, um, because Jerrod is a regular and because he's got his fingers into so many research pies that I pretty much let him suggest topics to me that he thinks people would want or need to learn more about. And today is one of those days where I never would have thought of the topic of the day. But tell me, Jerrod, why did you pick to choose? Why did you choose constipation of all
Yeah.
things to talk about for 45 minutes?
Yeah. It's not something most of us talk about, but I have 2 separate certifications related to the gut
Okay.
and digestive health issues in general. It's not FASD specific.
For
I'm
a
working
minute,
on
I thought you were going to tell me you were certified in constipation. I was
I
a little
wish there
worried.
was a certification out there for that. I'm not aware there is one, but maybe there is.
I was a- well, of course, you could get a bachelor's degree in it, or because how we have the initials after our names, BS.
It's such an important topic, my friend. We don't think enough about this. And
Yes.
I do a lot of consultation work, lots of trainings on a variety of topics, and the gut brain axis is one of them,
Yeah.
digestive health issues. And there's a lot of behavioral health literature related to this, neuroscience research. That's the angle I'm going to take today. I'm not going to get
Okay.
into the weeds too much with hardcore medical,
Yeah.
but I'll talk a little bit about that. And this is a topic that comes up frequently in my consultation work.
Hmm.
And it is a topic that is talked about in the FASD literature a little bit. You will find some articles that have studied this directly or indirectly, where they have found that constipation may be more of an issue among some people with FASD. And there's a lot of reasons for that. And there's not a lot of research. So we need more
Okay.
research. And a lot of times people ask too, why do you give talks on related topics? Because you're very interested in the world of forensic mental health and the criminal justice system.
Hmm.
The hat I usually wear now is as a neurocriminologist, neurocriminological informed professional. And
Okay.
that is basically taking neuroscience, biochemistry, behavioral genetics, nutrition, all that stuff, and helping better understand complex human behavior and criminal behavior. And there have been a handful of studies now that are talking about gut brain axis dysfunction and digestive health issues might be a biological kind of target area for intervention if you want to work on helping people reduce anger and irritability and really problematic behavior. You're going to find a million studies on this related to mental health, but not a lot on FASD. So that's kind of why I do this. There's a huge
Yeah.
connection between, again, what goes on in the gut and what goes on in your brain. It's interconnected.
So I know it's got to be a bit more than just if we find ourselves backed up a little bit, we get cranky. There's got to be more to it than that.
Yeah, so constipation is one aspect of like a digestive health kind of issue.
Mhm.
It could co-occur with something else, a medical issue. It could be a standalone complaint. Everybody deals with this from time to time. But there are people in my own personal life who I know deal with this all the time, which has a huge impact on their overall quality of life, their sleep, their energy level. It even in the literature, not FASD specific, but chronic constipation could almost be a trauma for some people. It can create shame and worry and
Mm.
fear and isolation. And if a child is dealing with chronic constipation day in and day out, there could be a lot of fear around that, especially as that child has to start going to school. So look at it maybe through at least a stress lens. It adds stress to the person's life. And it could be potential medical trauma.
Mhm.
The severity, it really depends on the severity. So,
Well, I know with, I frequently bring things back to my mother, right? So she has dementia, she's elderly, she's almost 92, and she's back on hospice. And every time the nurses come, they always ask me, when's the last time she had a bowel movement? And in thinking of medical trauma, my mind goes to how emotionally and psychologically uncomfortable it would be for someone to have to manually move that stool. Um, but I have the feeling you're thinking of something else.
we'll talk about that today too. That plays a huge role in this.
Yeah.
Constipation is one sign that maybe the gut is not working at optimal levels.
Mhm.
Again, a lot of factors, it depends, but bloating, gas, diarrhea, all of those things are signs of an unhealthy gut. Unusual weight changes are a sign of potentially a gut that's not working at optimal levels. People that have a lot of skin problems look to the gut, not all the time. Unexplained fatigue, look to the gut a lot of times. Autoimmune
How
issues.
does fatigue and quality of sleep, you hinted earlier, how do those things relate to gut health and constipation?
Our gut has its own nervous system called the enterotic nervous system.
Okay.
The gut is the hub of our immunity. A very large percentage of our immunity is in the gut. So if the gut's not working, our immunity is not working at optimal levels. If our gut is off for whatever reason, if there's gut dysbiosis, kind of an imbalance between good bacteria and bad,
Yeah. Yeah.
that can relate to more inflammation in the whole body. People with diabetes, just Google diabetes and gut brain axis, Google Alzheimer's disease and gut brain axis, depression.
Mhm.
Look to the gut. You're finding numerous studies that talk about if you want to enhance human health, get the gut better, because if the gut is not working properly, everything else from that can just not be working that well, including the
Mhm.
brain, because the brain and the gut communicate. And if you're working in mental health and you're listening to this, there is without a doubt unrefutable evidence that digestive health issues make mental health worse and mental health issues make the gut worse. So if
Okay.
you want to help people reduce depression, anxiety, whatever it is, do all the good things you're doing, but also target the gut with behavioral interventions. And that's a whole can of worms we can open today if you'd like a little bit, but
Well, yeah, I'm curious about behavior interventions with gut health.
sure. Look at the research literature related to psychogastroenterology. It's the combination of psychology
Mhm.
and gut science. And that research literature talks about hypnosis as being an intervention, positive psychological interventions, cognitive behavioral therapy.
Mhm.
There's a lot of studies that show that CBT can be very effective for people with IBS, referring to a nutritionist, getting sleep better, just self compassion exercises. teaching people how to manage stress more effectively, that plays a huge role in optimizing the gut. Because if you're under a ton of stress, what do you feel? Your gut hurts, your gut starts
Mhm.
tightening up, you're not sleeping well, your hormones are off, you're inflamed. That's all a sign that the gut's not doing what it's
Yeah.
supposed to.
So this is a whole lot more than just adding more fiber to your diet.
That is one of the big things that comes up in the constipation literature is fiber.
Mhm.
But again, we're not giving any medical advice, people, today.
Right,
Talk to your
right.
doctor, but I'll tell you what the research literature absolutely says about that. But before I jump to that, Patty, can I give a little more background about
Absolutely.
constipation in general? So
Yeah.
it's on a spectrum, without a doubt. You can have more mild cases, more severe. It could be acute, it could be chronic. So acute might be very situational. Maybe someone's going through a lot of stress and a breakup, and they're using a lot of alcohol now.
Mm.
After they deal with that stress, after maybe they cut down on the alcohol or quit, maybe their constipation goes away. More acute, more situational. Chronic could be, in some cases, someone that was exposed to drugs and alcohol in utero,
Okay.
where maybe we have some nervous system dysfunction. But then when the child's born, we have environmental factors too. Maybe they're living in a very chaotic housing environment or dealing with a lot of stress.
Mhm.
So a lot of things to think about there.
Yeah,
You'll find
so
different
I know that alcohol, where the various systems of our gut is actually the first thing to come online, with central nervous system being second. You know, I think that's the right order.
well,
So,
the nervous system would develop the neural tube in the brain would be the first thing
okay.
to develop.
And then the
Yep.
gut is second. So I knew they were one and two. Um, for instance, I was learning the other day, I read some research from 2021, that the key pieces involved with insulin production and um, messaging, I think it was, are all in the first 5 days of conception. So, I mean, clearly there's a lot going on with the gut,
Yeah. Oh
very,
my.
very like immediately upon conception. Um, so that tells me, well, yeah, it's a no-brainer that if there's alcohol exposure in that first week, for sure, but for several weeks, that we will have chronic issues.
Yeah, I can't say like blanket statement, everyone exposed to alcohol in utero would have constipation, but it sure does not make the situation,
Yeah.
unfortunately, any better. And I've consulted on a lot of cases where this does come up, but it's really not
Mhm.
on the radar of most people. Like, it's kind of a secondary thing. It's not, let's worry about the executive function, the self-regulation
Mhm.
deficits first. We'll get to the constipation, sleep later. Well, I'll encourage that maybe we need to look at all of this simultaneously because they're really interconnected. But constipation symptoms and definitions are different depending on what organization you look at. But typically, passing fewer than 3 bowel movements a week
Mhm.
is a sign of constipation. Having very hard stools, difficult to pass stools, lots of straining, bleeding, very painful bowel movements, feeling very sluggish and bloated, uncomfortable, abdominal pain. Those are all different symptoms of constipation, and it can definitely differ from person to person.
Mhm.
The overwhelming majority of constipation is really falls in the umbrella of functional constipation, which is basically, I've seen stats, maybe that's as high as 95% of all cases of constipation fall under the umbrella of functional, and maybe around 5% are organic in nature, where there's actual structural integrity issues, something like that
Okay.
going on. We're not talking about that today. We sure can in another segment. That's heavy duty medical.
Mhm.
Functional constipation is probably what most people are going to be dealing with. Usually there's not like a obstruction. It's situational nature. It's usually multifactorial to a lot of things can contribute to this. So before I move specifically into FASD, any thoughts, Patty? Anything you want me to just go a little bit deeper into with that?
No, I think I've asked the questions I can think of to ask as they've occurred to me.
Yeah, so again,
So,
it's a topic that's probably unfamiliar even to a lot of FASD experts
mhm.
out there. But planting the seeds that this is important, I
Yeah.
hope this stimulates more of a conversation for us.
Yeah, I did just think of another question. You mentioned before we started recording that a lot of people ask you, "Hey Jared, why are you talking about this?" Because it's not your everyday conversation, and it seems that the only people talking about constipation are the pharmaceutical companies peddling things on our TV commercials. And so given most of your work is in forensics, um, uh, tell me that tie-in. How might irregularity, right, or constipation be affecting the forensic population or those of us who get into trouble with the law?
Yeah, there's nothing specific to FASD, criminality, and constipation, but in the general criminal justice literature, that there's a sprinkling of articles you'll find where constipation's an issue among folks in prison. And the reasons for that, they say, sedentary lifestyle,
Mhm,
the eating in prisons usually is consuming foods that are high in carbs,
mhm.
sodium, sugars, things that are not good for you. If you
Lower
Google,
fiber.
yeah, to think of the stress that people are under in prison, even solitary confinement. Let's say someone was in solitary confinement because they have a lot of behavioral issues.
Mhm.
It is something that does come up, not a lot, but if you Google like prison and constipation, you're going to find a few things, and there's some case studies out there too. It is a very important fundamental component of human health. If your
Mhm.
gut again is off from whatever reason it is, constipation being one of many, you're likely your behavioral health is not at optimal levels too. So you might, in some cases, be more prone to be angry or
Mhm.
irritable or
Mhm.
depressed or anxious or not sleep well.
Yeah.
So if someone already has some underlying brain-based impairments where they're more prone to making bad decisions, it doesn't help the situation get
Yeah.
any better.
Yeah. And your comment about solitary confinement, I
Mhm.
think that is the dreaded consequence because for, if you're at all social, being in solitary would be extremely stressful, right? Because we are social creatures, and the deprivation of that would be enormous stress.
Oh yeah, enormous on the brain
Hmm.
and all the body functions. Yeah, and very, very difficult. I can't imagine.
Yeah.
So
Okay.
if we look at this specifically through an FASD lens, the research literature has talked about some people with FASD might be more prone to obesity. And there's a lot of
Mhm.
metabolic and biochemical reasons for that. I've seen it go both ways, where I've consulted on numerous cases where the person has been very overweight, but there have been cases I've consulted on where they've been extremely underweight because eating problems, feeding issues,
Mhm.
lots of things like that. There are a few studies that have found, at least in the sample size they looked at, folks with FASD might be more likely to consume a higher degree of sugar. Excessive sugar
Mhm.
consumption is one excellent way to make your gut very, very bad if that is a goal.
Okay.
So the takeaway point is reduce sugar intake. But again, talk to a nutritionist. Constipation does come
Mhm.
up in this literature. And part of the reason is think of the nervous system, think of prenatal alcohol exposure, how it can damage the autonomic nervous system
Mhm.
and all the things with the peripheral nervous system. If you understand those
Yeah.
components, that would be helpful to understand. What
So
about
so
symptoms of,
for those listening who don't have that understanding of the autonomic versus peripheral nervous systems, and how that ties in, there, I think with the autonomic nervous system, basically one thing you're focusing on is the speed by which things pass through from mouth all the way to the exit.
Yeah, you can divide that by like the sympathetic nervous system and
Mhm.
the parasympathetic division, rest and digest versus the fight or flight response,
Mhm.
and then the central nervous system, brain and spinal cord, the peripheral nervous system, kind of the circuitry that goes out to the rest of the body and
Right.
how we communicate and signaling and all of those things that all connects to the gut and our muscles. And prenatal
Mhm.
alcohol exposure can adversely impact
Any
really
of it.
any of those systems.
Yeah. Yeah.
And for some people too, what happens if we're talking about trauma?
Mhm.
Hyperarousal symptoms have been linked, trauma symptoms, emotional distress have been linked with more constipation issues. So
Yeah,
well, I
I
got
can
some more
see
things.
that.
Yeah,
I can see
absolutely.
that because when when our body goes into alert, right, it shuts down that motility,
Yes.
right? Our bowels and our bladder evacuate because we don't need to spend energy holding on to things when our legs need to get us moving and our lungs need to get the blood pumping. So that whole digestive system just gets evacuated and put on standby. And as you say, if that's happening chronically, then that might be very confusing to the body.
Absolutely. And what happens if someone has the urge to go to the bathroom, but just continues to ignore it all the time and holds it
Mhm.
in? That's a factor to take into account.
Mhm.
Certain medications can
Mhm.
absolutely play a role in this. I consult on a lot of cases where the behaviors are more extreme. So by no means am I saying everyone with FASD has extreme behaviors. This has just been my experience and with more extreme behaviors in the cases I've consulted on, most of the folks are on a ton of medications for
Mhm.
a variety of psychiatric and physical health issues. So certain medications can be a factor.
Well,
Talk to
like
your doctor, of
pain
course.
medications,
Sure,
they all
sure.
come with that warning. And again, to bring my mom into it, when they brought pain medication, they also brought stool softeners, right? Because and they said we don't give out pain medications without this because we don't want her to end up with a problem. Yeah.
Huge issue. Sedentary behaviors, big
Hmm.
issue. Unfortunately, a lot of cases I've consulted on, the person has lived in a group home where they might not move a lot. They're watching
Hmm.
TV,
Hmm.
low grade dehydration, not having enough fluids
Yeah.
or the right kind of fluids too. If
Yeah.
someone maybe is drinking soda all day long, but they don't drink water ever,
Yeah.
a factor to take into account. You mentioned fiber, that comes up
Hmm.
all the time in this research literature. Not having fiber or even changes in routine in the general
Hmm.
constipation literature. Someone even travels for something positive,
Hmm.
or they just have a change in their day-to-day routine. People with FASD, a lot of times, changes in the routine can be even more stressful.
Yeah.
So definitely another variable to take into account. The abuse of laxatives or
Mhm.
on these other kinds of substances, are they good or bad? Debatable, depending on how
Mhm.
long someone's on it. Behavioral factors play a role. Remind me if I forget to go through a good list of behavioral factors that come up in this literature. The psychological factors, if someone is dealing with really heightened emotional arousal, which is pretty common with people with FASD, because
Mhm.
sometimes that inability to self-soothe is one of the big reasons why people with FASD really struggle with sleep issues. So if someone is dealing with heightened emotional arousal, where it's
Yeah.
roller coaster rides of
Yeah.
emotions, those are psychological causes for constipation in the general literature. Even high irritability. If someone is just wired to have a lot of irritability and they're just moody all the time,
Mhm.
that energy is going somewhere. And a lot of times it can go into the gut and slow things down and make our bodies not work.
Yeah.
High anxiety, untreated depression, and lots of stress where someone doesn't know how to cope are all
Mhm.
psychological causes for constipation. Another thing, I mentioned the trauma again. Unfortunately, if you look at some of the sexual abuse literature, children who were sexually abused earlier on in life may be more likely to be dealing with constipation.
Mm.
And there's a lot of reasons for that, but any kind of trauma needs to be taken into account.
Yeah.
Bullying is talked about. Again, all of this is more general literature. It's not FASD specific,
Mhm.
but I think it can
Mhm.
be applied to any population. But peer victimization and bullying is a potential contributing factor, the research says. So if your child's in school, are they being bullied or teased?
And
Is
so
there
many
any?
folks with FASD are.
Yeah,
Excuse
unfortunately.
me. I mean, even I was the target of bullies back in the 1960s, 1970s, early 70s. And so, yeah, and I totally lost my thought.
Okay. I I have given a lot of talks on bullying and I have done a few on FASD, and it is a real issue that
Mhm.
comes up a lot. And it's not just going to be bullying at school, but you will find in the constipation literature that even sibling rivalry could
Mhm.
be a stressful lifestyle factor that could contribute to functional constipation among some children.
So I have a question for you, Jerrod,
Mhm.
because it
Yes,
came back quickly this
yes,
time.
that's good.
Often, sometimes my thoughts are totally derailed, but in this case, it came back quickly. Oftentimes, you will hear people say, in reference to especially kids in care, because that's where I've worked in the last 25 years is foster care. It's just the one thing that they have control over, right? What goes in the mouth and the timing of when things are evacuated is the only thing that a child can maintain some degree of control in. Does that line up with the research?
Well, if it's a child with severe neurological impairment or some sort of severe disability, do they have all of the control and choice? Do they have choice making deficits and they're just so impulsive? The answer, I would think, probably not in every single case. If that child is dealing with abstract reasoning deficits or high levels of disinhibition, executive dysfunction, if it's a child who maybe is a 10-year-old child on paper, but because of some severe neurological impairments, do they function as a 4-year-old or a 5-year-old?
Yeah.
Problem in every case is so different. So I would
Yeah, I
say
mean,
no, not every child.
I used to believe that because that's the only explanation that we're given, right? Oh, it's just the only thing they can control, if they'll settle in, once they're adapted to life in foster care, things will right themselves. But I don't know that I believe that at this
I
point,
don't think that's
especially with
no.
everything that you're saying. Um, it doesn't, it no longer makes sense to me.
And that's why I am studying to be a functional kind of nutritionist, and
Mhm.
functional is getting into the weeds, digging deeper, looking at holistic kind of lifestyle medicine approaches too, where every person is different. There's
Mhm.
lots of gray. There's rarely yes or no's,
Yeah.
straight answers. There's lots of moving parts, and you try to dissect all the moving parts, and then you have all the pieces, and you start piecing it together. And that's how I'm doing it. I'm not saying I'm right, but yeah, every child is so different. And just taking constipation as one of those topics that many we've explored. Look at all the things that could play a role.
Mhm.
Even failing an exam in school is a potential lifestyle stressful factor that can
Mhm.
cause childhood constipation. A child in a home where the parents are going through a high conflict divorce
Mhm.
has been talked about as a potential factor.
Mhm.
Now, the FASD world, a few articles have been published on this that talk about it. And they usually always stress more research is needed, small sample sizes. But some of these studies have found that disordered eating patterns
Mhm.
are more common. I am not aware of studies that have looked at this with adults with FASD per se, it's usually younger individuals. But if that child with FASD has some really inappropriate food preferences,
Mhm.
where maybe they almost have like a tunnel vision to, I'm only eating fast food, or I only will have this candy bar, or only this soda,
Well, we see a
all
lot
of
of
it.
that in foster care, don't we?
Absolutely. Yeah. I mean, the trauma in and of itself and the attachment is another
Mhm.
variable. So those
Mhm.
kind of problematic food preferences can set people up for constipation.
Yeah.
Poor self-regulation, which is a classic symptom in FASD, is a variable that's talked about.
Mhm.
And then just thinking of all the medications that some people with FASD are on, and the stress that sometimes people with FASD carry along with them because
Mhm.
of really
Mhm.
painful early childhood experiences, separation from birth parents, foster care placement to foster care
Yeah.
placement, we can start seeing a pattern why we see this anecdotally. And some research is pointing to the fact that, yeah, we're seeing more of this. But some of the studies say it's not a common symptom or sign in FASD. I disagree with that, even though the research is out there, because I've seen enough cases, I hear story after
Mhm.
story
Mhm.
that this is an issue that comes up. And it's probably a combination of factors: how we eat, what medications person's on, their mental health status. But
Yeah.
then you kind of alluded to this. The prenatal alcohol exposure
Mhm.
could actually damage nerve receptors and the
Mhm.
signaling in the brain, and
Mhm.
our teretic nervous system isn't
Yeah.
communicating with the HPA axis and our
Well,
central nervous system.
that kind of makes sense, doesn't it?
Yeah.
Because, looking at, oh, I have a cat playing with the camera. Come on, Lily, move along, dear. Oh my, go bother your grandmother. Um, yeah, she invites herself to play cards with us too, and it really doesn't work very well.
Love animals. Animal assisted therapy. Way to go.
Right now, it's animal assisted annoyance. And what the heck was I gonna say? Um, okay. So with the alcohol hitting our system and destroying structures, right? When I was looking at our sensory systems, one of the things that can take a hit where we see a lot of primary characteristics is nutrition and the way our body interacts with food, right? So one of the issues, of course, is that sweet tooth that many of us have, myself included. But in other common things is that either our brain never gets the message through the gut that says I'm hungry, right? And that's a real thing. And hunger does lead to anger, right? I mean, that whole hanger thing, being hangry,
It's
and Mars
low
candy
grade
bars came up with a,
hypoglycemia, probably.
yeah, but Mars
Yeah.
Candy Bar Company capitalized on that with their Snickers commercials, right? Of being hangry and not yourself. But another common issue is that the signals of being full may never make it to the brain. So it stands to reason that if there are biological detours from the signaling of hunger or satiation, not making it to the brain in order to generate the right behavioral response of either eating or not eating anymore, it only makes sense that it could be a very physical, structural, neurological issue of the rest of it, moving through the body with the right speed so that the right amount of fluid stays with, the feces moving through.
It's more complicated, I think, when we're talking about these prenatal insults:
Mhm.
drugs, alcohol, tobacco, traumatic brain injury in utero, and that's a whole nother unfortunate can of worms. But so what do we do about this when there's not a lot of research literature out there yet on this?
I'm glad you asked that question because I was going to ask you,
Look
what do we
to,
do?
well, look at what the intellectual and developmental disability literature says. Lots of studies on constipation among people with IDDD. Everything that I talked about before applies to this population too, but in the IDD literature, it talks about rumination as being a potential factor. So targeting rumination. Some of that literature talks about it could be neurological in origin. So look to the brain, of course. It
What,
does talk about, go
what
ahead.
do you mean rumination for those who don't walk around with a Webster's dictionary?
Mhm. Yeah,
I think I know, but I'd
yeah.
love to have you tell us.
Getting stuck on something, usually
Okay.
not good things, anger, depression, and it just spirals and and grows and
Okay.
grows and grows and grows. Catastrophizing, seeing the future as terrible and black and white
Okay.
thinking and yeah,
So it's like perseveration, but on the dark side.
we're probably on the same kind of continuum and stuff. Yeah, definitely. And targeting
Okay.
rumination, helping people calm down, slow the brain and body down. Health inequities are talked about in the IDD literature too. So that's another variable to take into account. You're going to find a good handful of studies in the autism world as well on constipation. So where do you look to? Look to those literature bases, I
Mhm.
think, too. Researchers listening to this, students, ample room for more studies on this, of course.
Mhm.
Shame, targeting shame, high levels of shame can absolutely make our bodies not work at optimal levels. Shame is a toxic emotion, not a good thing.
Mhm. And that's a
Looking at,
central experience that a lot of us have
sure,
before the FASD is identified and supports put in place. We
yeah,
are often left feeling as though there's something wrong with us because
yeah,
things that are so easy for other people are such a battle for us
yeah,
to get accomplished. We can, sure, we may be able to do everything, but what at what price?
yeah,
What is the toll that it takes on us, the energy depletion that
yeah,
outside, people outside ourselves don't see? And that
absolutely,
brings shame with it, you know?
absolutely, absolutely. Can I share a case study that comes to mind?
Yeah.
This is a case I consulted on a good handful of years ago where I never thought about constipation at that time as being a factor. If I could go back in time, I think,
Mhm.
did a little bit different in terms of advice I'd offer to the caregivers and professionals. This is a client, adult female who had FASD confirmed, had high levels of anger management problems. And she also dealt with a lot of gut issues, including constipation. Her symptoms were lots of daytime fatigue,
Mhm.
feeling overwhelmed, had a really hard time multitasking. She dealt with a lot of sensory overload, so lots of bright lights and sounds were not good. A lot of blood sugar dysregulation, so meal skipping, low blood sugar
Mhm.
levels, high levels of irritability, lots of confusion at times.
Mhm.
When her routine was broken, not good. That was very, very bad. Poor social skills, high addiction to the screen,
Mhm.
and nicotine and sugar. All of those were triggers for her anger,
Mhm.
but a lot of those too, I think, looking back on it, probably made her constipation a million times worse.
Mhm.
The coping skills that seem to work more effectively for this person, laughter, getting her to laugh, that
Mhm.
seemed to kind of diffuse the situation. So
Mhm.
laughter can be a wonderful tool, using it effectively, of course.
Yeah.
Helping her learn how to walk away from things, not to just have to confront every single issue. Just
Mhm.
let it go sometimes. So that was helpful. Teaching her how to count back from 10 to buy herself a little time to slow down. Easier
Mhm.
said than done.
Yeah.
Coloring, journaling were very,
Mhm.
very helpful. Managing daytime fatigue, so learning how to just be more aware of your body sensations,
Mhm.
maybe taking some naps here and there. Eating
Mhm.
healthier, the group home worked with her on that. I think there was a nutritionist, maybe a referral, taking more breaks, pausing, listening to some soft music, and just going for walks. A lot of these things are common sense, but
Yeah.
for this client specifically with FASD, these were some of the challenges and some of the coping strategies.
Yeah.
And constipation, I can't say was like the main driver here, but it was definitely a factor that I even didn't think much about. And I don't think anybody else did at that time too. But you get the gut better, a lot of those other things are a lot better too.
Yeah. And you've that seems to be a central theme in many of our conversations, where the two things that need to be looked at if life is going amok is gut health and sleep.
Heck yeah. And nutrition. I mean, those
Mhm.
to me,
Mhm.
they're all interconnected, and
Yeah.
it doesn't matter the diagnosis if you have FASD or not. If we're not sleeping, our guts off, and you eat terrible all the time,
Mhm.
how good do you truly feel? Maybe you get away with it when you're younger. I know I could get away with it back in the day when I ate terribly back in college, but if I eat terrible even one meal now, I feel so tired and
Yeah.
jittery and anxious, and
Yeah.
we're not getting any younger, unfortunately.
Yeah,
So
I hear that a lot. And the other thing is we need our sleep, right?
yes,
We
yes.
can't stay up into the wee hours of the night the way we could when we
Oh,
were in our teens and 20s.
yep. I know. I
Yeah.
agree, 100%.
Yeah.
Couple other variables just want to plant the seed here with before I give some more strategies is that low self-esteem may
Mhm.
be a contributing factor to more constipation in children. Some studies have found. So another area to target, regardless of who the person is, if their self-esteem is in the gutter,
Mhm.
help them build more self-worth, self-confidence,
Yeah.
self-efficacy. And how do you do that? Kindness, compassion, empathy, validation, helping the person feel like they belong.
Mhm.
Now, there's some studies, there's conflicting evidence in the research literature on this, but I've seen anecdotally lower socioeconomic status. Some studies say makes constipation or can play a role in constipation. Other studies say no, but it
Mhm.
makes sense to me. If someone doesn't have a lot of money, they're probably not eating that healthier
Yeah.
foods.
Yeah.
Do they not have the best health insurance? Is there transportation barriers here? I mean, all
Mhm.
of these things should be considered. So just
Yeah.
another piece of the puzzle to take into account. Before I give some just general strategies, any other thoughts, Patty?
No, I mean this conversation's been a lot broader ranging than I would have imagined.
Yeah, yeah. So we talked a little bit about the nervous system today,
Mhm.
not a lot, but we know that people with FASD, the nervous system has been impacted by
Yeah.
prenatal alcohol exposure on some level.
Yeah.
There's many components of the nervous system, but the research says if you want to help get the parasympathetic nervous system in more balance, so if you want to feel more in balance, what do we do about it?
Mhm.
Rest, sleep, eat healthy, exercise, reduce stress. Yoga has been shown to be effective.
Mhm.
Meditation, deep breathing,
Mhm.
talking to a trusted therapist, setting realistic goals. Don't set unrealistic goals for someone who can't achieve them. So take into account their emotional developmental age, build self-esteem,
Mhm.
learn how to set boundaries. I've forgotten
Right.
that anger management case study. That was another strategy that seemed to help. This person had a really hard time saying no because they really lacked assertiveness.
Yeah.
Teaching people it's okay to set boundaries, create balance,
Yeah.
and to say no. So those are
Yeah,
some things
because
that
when
talk
you
about
don't, you end
nervous
up
system.
burying resentments,
Oh,
and
yes,
there goes the
absolutely.
anger. Yeah.
Yep. I cannot agree more. 100%.
Yeah.
Health literacy and nutritional literacy, very important for all of us. So if someone has low levels of nutritional literacy, that means they probably don't know how to read labels that well and
Mhm.
understand ingredients and portion sizes. And it may actually play a role in not being able to know how to cook healthy meals. So
Mhm.
focusing on that with someone can be very helpful, and
Yeah.
maybe doing that in conjunction, obviously, with with your healthcare provider.
Mhm. Mhm.
If you're working with someone with FASD and they have really poor dietary patterns, a lot of reasons for that. But could it be a lack of just knowledge in general about nutrition? Could it be poor planning or poor organization or time management?
Mhm.
These are all practical skills that you could teach someone with FASD, obviously in conjunction with a qualified professional. And again, I'm not giving any nutritional advice. Here's another area that I'd love to talk with you about, Patti. There's zero research on this that I'm aware of in the FASD world, but a million studies in other fields. The Mediterranean diet
Mhm.
has been shown to help combat functional constipation, functional digestive health issues in a
Mhm.
variety of populations. But there's no research in the FASD world that I'm aware of. It would be fascinating for someone to
Yeah.
look at comparing a group of folks with FASD who ate the Western diet
Yeah.
versus who was on a Mediterranean diet.
Yeah.
I'd be fascinated to see what would happen there. Really, really
Yeah.
good. The Mediterranean diet is basically lots and lots of fruits and vegetables, low in red
Mhm.
meat,
Mhm.
very, very probably no processed foods. You're
Mhm.
eating lots of legumes and very healthy kinds of
Yeah.
foods. You're not overeating. You're having, you can probably have eggs on it, but you're not having a ton of eggs like every
Mhm.
single day, and
Mhm.
moderate use of dairy products. And the research in general on the Mediterranean diet, if people eat this way day in and day out, fascinating research, but it shows it can reduce inflammation.
Mhm.
It can enhance our immune health. It enhances brain health, our gut health, all kinds of things. What role does that play in FASD? I don't know.
That would be
And I'm not
fascinating.
advocating for you
Yeah.
to change a diet unless you talk to your healthcare provider,
Right. Right.
but something to think about.
But, and this is obviously a call to action to any researchers who may be listening to consider developing a study to look into this. So, because it would be fascinating. And you mentioned low on dairy, and I'm kind of curious what you can say about um, the health impacts of dairy milk versus the quote unquote milk that comes from various plant products like the almond milk or whatever else, the milk substitutes. Um, to
Yeah.
me, I'm thinking anything that's manufactured is going to be a struggle for the body to process. Like for, many, many years ago, probably 15, 20 years ago, I went through a phase where I thought, okay, meal substitution, I'm going to start drinking Glucerna, which is made for diabetics, right? As a meal replacement. Doesn't taste too bad, tastes a whole lot better than Ensure. But then I found that I wasn't losing any weight. And then I heard the results of another study that said, and I have no idea what the reference is, but it said if you can't pronounce the ingredients, your body doesn't know what to deal with, doesn't know what to do with it, and will shove it into storage and it will build up your fat instead of taking it away. So that makes me think, well, I wonder about almond milk because that's not natural.
Yeah. I am again not giving any advice to any of you. Talk to
Yeah.
your healthcare provider. But for me personally, I only drink plant-based milk products now. I changed
Mhm.
my diet radically a few years ago. And it's not just, okay, you move from dairy to almond milk. You got to look at the ingredients. There's a lot of
Mhm.
almond milk, for example, out there loaded with sugar.
Mhm.
The things that I drink, organic, you can pronounce the ingredients. There's usually like one or two ingredients in there. It's usually like almond milk and maybe a little sea salt or something.
Mhm.
It really depends. And with the dairy, again, it really depends on the processing and what
Mhm.
kind of hormones were used and ingredients, or was it organic and natural?
Mhm.
Ruling out, I didn't talk about this today, we didn't have time, but for some people, they may have a food allergy or food sensitivity
Mhm.
to dairy or whatever. It could be to anything.
Yeah.
Ruling that out with your doctor could be very helpful. I've given talks on like energy drinks, sugar sweetened beverages. I talk about diet sodas. This is my belief. Again, you'll hear this sometimes, like if someone is consuming a high degree of sugar sweetened beverages, let's get them over to diet.
Yeah.
This is my opinion. Don't take it and run with it. But if you look at the research on the ingredients in diet soda, for example, it's not good. It can actually dysregulate blood sugar levels, which people are surprised to hear that. Well, it's diet, there's no sugar. The reason for that is some of the ingredients in some of the diet sodas adversely impact the gut, which then can inflame the gut. And then that inflammation over a long period of time can spill out into the rest of the body, cause an inflammatory response, make our blood sugars go wacky. Just if you want to learn about that, go to Google Scholar, Google stuff. You'll find numerous actually empirical based articles that talk about those things.
Well, I
It's really
stopped drinking
fascinating.
Crystal Light after one of our earliest phone conversations. So
There's a lot of things that hopefully I'll be able to talk more in detail about once I complete that nutrition program. But
yeah,
there's actually a lot of literature. Well, I say a lot, there's probably 10 or 15 studies on FASD and nutrition right now. At some point, maybe we could talk about what those studies say. It's
Okay.
really important to understand the role of nutrition when understanding FASD, and a nutritionist does play a vital role, I think, in helping people with FASD live a more healthy life. In addition to their psychiatrist or case manager, language, speech, occupational therapy, case manager. It's part of a team.
Yeah.
Again, it's one aspect, but in my opinion, because I'm studying it and I really want to do more with this, I think it's a vital aspect because think about this. Let's say we eat 3 meals a day, 30 days in a month on average. Look at how many meals that is. Look at how many times we can influence our health with positivity in what we eat. Or if someone's eating terrible day in and day out, look at how many strikes and impacts they have to their body metabolically and biochemically every meal. And that's not including snacks and waking up in the middle of the night and going to the fridge and having a whole pie, which there's a case I consulted on where they had to move the client's room because it was right beside the kitchen and he would sneak in there every night. This was a suspected FASD client. So a lot of things. I know I'm opening a can of worms, but again, poor dietary practice is a big factor to take into account with the constipation issue.
If there's anything you do well, Jerrod, it's giving us all food for thought. How do you like that pun?
Yeah.
Given our topic.
If your audience, if this is well received and they have questions, I mean, I'm more than happy to come back and do a part 2 and we can dig a lot deeper into some of those other rabbit holes with this. But hopefully at least it stirred a conversation today that it does come up. It is empirically supported, and we should probably consider it as another variable that probably makes behavioral problems worse if someone is chronically constipated. Not saying it's the only driving factor, but it might be an area to work on.
So certainly people can reach out to me at livingwithfasdpodcast@gmail.com with questions. Can they reach out to you as well?
Sure. Share my email, you bet.
Okay. All right. So everyone, that will be in the show notes, both those emails. And we've been our time is already at a close, amazingly. So, so on that note, I would also invite people to go to patreon.com. That's patreon.com/livingwithfasd podcast. It's a community you can join for free. Or if you're so inclined, if the content, not just of today's episode, but content in the show in general has been beneficial to you, then I would ask that you prayerfully consider a very small token donation of $5, $10, or $15 a month, which will, you would set up with Patreon directly. They pay me, not you pay me. So that this content will always be free. But what that monies do is help me cover production costs. So because this, bringing the show in week after week is a sacrificial endeavor that I gladly do, but I'd be lying if I didn't say it would be nice to have a smidgen of help. So again, only if you feel led to do that. No worries, no pressure. This show will always be here and always be for free to the listeners. So there's also great groups on Facebook. Flying with Broken Wings is one where you will have the camaraderie of people living with it, with other caregivers and other professionals. And I just thank you so much for tuning in this hour, spending the time with us, and hope you come back again next Monday for another episode of Living with FASD, Candid Conversations with Patti Kasper. I'm your host, wishing you a wonderful week. Take care, everyone.